An ominous warning today from the CDC sent the stock market into a tailspin for the second straight day. At the close today, the Dow was down over 800 points. That brings the total loss over the past 2 days to 1,900 points.
I want to bring in our Dr. Frank McGeorge with the CDC's warning.
Right, because they're saying it's not a matter of if, but when a hot spot pops up here in the United States.
That's exactly it, Kim and Devin. So let's start with the daily numbers. There are more than 80,000 cases around the world, with over 2,700 dead from the disease. Here in the U.S., there are a total of 57 cases. 40 are from the repatriated Diamond Princess passengers. And today, both the CDC and the Secretary of Health and Human Services changed the tone of the message they want Americans to hear.
Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected and how many of those will develop severe or more complicated disease.
That message from Dr. Ann Schuchat, the Principal Deputy Director of the CDC, was echoed in a conference call by Dr. Nancy Messonnier, Director of the National Center for Immunization and Respiratory Diseases.
The data over the last week in the spread in other countries has certainly raised our level of concern and raised our level of expectation that we are going to have community spread here.
Her warning to the American public was personal and direct.
I had a conversation with my family over breakfast this morning, and I told my children that while I didn't think that they were at risk right now, we as a family need to be preparing for significant disruption of our lives.
This is a very serious public health condition worldwide. We are taking this incredibly serious here in the United States. We are doing the most aggressive containment efforts in modern history to prevent further spread in the United States. We're going to continue taking those measures, but we are realistic that we will see more cases, and as we see more cases, we might have to take community mitigation efforts.
Community mitigation will take the form of measures that include, number one, personal protective steps like hand washing or the use of masks when indicated. Number two, social distancing, which may mean work and school from home using telecommuting. And number three, decontamination of the environment.
Based on what we know right now, we believe the immediate risk here in the United States remains low, and we're working hard to keep that risk low. But we must use this time to continue to prepare for the event of community transmission in the United States.
Now, in spite of these important warnings, there is a glimmer of good news. The physician who led the World Health Organization mission that evaluated China's response to the outbreak, he did find a plateau and even a decrease in the rate of infection in China, which does suggest that their public health measures may have a positive effect.
Yeah.
Well, every day we're still also learning about things that we don't know yet.
Right. We're learning more. And remember, China did some very aggressive public health measures that may not fly here in the U.S.
And the vaccine's still a ways away.
Quite a ways away.
Yeah.
More at 6.